Rates of malnutrition in Bangladesh are among the highest in the world. More than 54% of school-aged children, equivalent to more than 9.5 million children, are stunted and 56% are underweight. Understanding the depth of the problem, we have decided to work on the health and well-being sector, taking Nahar as our brand. Nahar soup is not only healthy but also the cheapest soup in Bangladesh. It contains sodium, carbohydrate, glucides, fiber, protein, vitamin A, vitamin C, calcium and iron, which are beneficial for human health. Taking all the costing nutritious facts in mind with the slogan Pushtite Shakti, here goes our first big idea, which is providing midday soup as a food aid to the underprivileged children. By this way, we can not only attract the underprivileged children to come to the school for better education, but can also provide them with proper nutritious food. Since now all the educational institutes are closed due to COVID-19, our first approach here is collaborating with different NGOs who can provide the food to community-based schools, marginalized children. Our second approach here is spreading awareness and make children understand about the importance of nutritious food. In order to do this, we will be circulating different animated storybooks and Nahar soup hampers, where they can learn about the basic food, vegetables, fruits, nutrition and Nahar that will be distributed through NGOs. In this way, by providing midday soup, by collaborating with different NGOs, we can solve the malnutrition problem that was a barrier for the overall development of Bangladesh. Novel COVID-19 has brought new challenges for healthcare workers. Over the past 6 months, nearly 7,500 plus health workers, including doctors and healthcare staffs, have been infected by COVID-19, and more than 100 plus have lost their lives as frontline workers. On top of health risk, they are facing additional work pressure and emotional stress. Many are working more than 12 plus hours without lunch breaks. Additionally, many cannot contact family members to avoid risk of spreading disease to them. The healthcare workers are receiving low standard food items, and there is a small gap between the two shifts of duties. This impacts their food consumption. Since the healthcare workers are working in the front line to fight COVID-19, it is crucial to assist in ensuring their health too. Taking this concept in mind with the slogan Pushtite Shakti, here goes our second big idea, which is strong healthcare workers program, which can be done by providing Nahar soup packets to them. Making a cup of Nahar soup is very easy and will be convenient for the healthcare workers to consume between their shifts. To implement this idea, our first approach will be to make nutritious food more easily available to the healthcare workers. We can achieve this by collaborating with NGOs to provide packages of Nahar soup to various hospitals. And our second approach here is to make partnerships with hospitals to deliver nutritious foods to them for their healthcare workers by a weekly package system to hospitals based on the number of employees. And our third approach is setting up stalls outside hospitals to raise awareness on healthy food choices and providing free samples of Nahar soup to the patients as well. We will also be putting up a board on simple information on healthy food and food choices that can improve immunity. This can be informative for low-skilled health workers because it is important to raise awareness among them about healthy habits. Our third big idea is raising awareness on better food choice and unequal distribution of food. As a country that has one of the highest rates of malnutrition, Bangladesh has seen a rise in obesity and diabetes over the recent years. Conditions that arise from overconsumption of food. It is possible for both underconsumption and overconsumption to be present within the same population when there is an unequal distribution of food. The high-income population can afford to eat too much and waste food, whereas the low-income cannot afford to buy enough. It is important to raise awareness on healthy food choices to ensure proper nourishment of the body, but also to avoid consuming unhealthy food. So here goes our first approach. We will continue with the Pushtite Shakti campaign to raise awareness through information-based advertisement. The advertisement will be branded through Nahar soup because it is a healthy food. We can include expert opinion and general food consumption guidelines. Since the target group will be middle class and above, social media advertisement will be the most approachable to all. The second approach here is we will try to raise awareness on unequal distribution of food. Nahar Food for All program will collaborate with campus ambassador to conduct fundraising activities and arrange methods for collecting donations. This money will be used to provide nutritious foods to the underprivileged children. Now moving on to our last approach, the celebrity endorsement. Celebrity hold a huge amount of fan following who trust their words. If they collaborate with our program, then it will increase public engagement. We can feature the celebrity in advertisements, create Facebook campaigns with them where they will provide nutrition tips. In order to ensure equal, sufficient distribution of resources, we can work together as BZBs to innovate, implement, and our society through simple daily Unilever product.